Congratulations, MAGA. Your vote for Trump is the reason why senior citizens will be kicked out of their nursing homes. Before you flood my comment section screaming fake news, I'm going to provide some verifiable facts. Google's free. You can go look at the bill. 60% of nursing home residents rely on Medicaid to cover their care. That is a fact. And Trump's new tax plan, it cuts the provider tax by 41%. This slashes how much support states receive from the government for nursing homes. That's a 41% funding cut. That is a fact. The American Healthcare Association says that 1 in 4 nursing homes could shut down and half of their staff will be eliminated. That's a fact. So where do these senior citizens go? Some might have family to take them in, but for others, this is the end of the road. There's no place for them to go. This is what your vote for Trump is doing. It's pushing vulnerable seniors out of care and onto the streets. And that is a fact. This isn't America first. This is our elderly last. If you voted for Trump, you made this happen. I hate to say it. This is on you.
Good afternoon, everybody. I'm still not selling anything, so hang out for a few minutes. Today is a little serious for me. You can officially say that you know or you have seen someone who no longer has health insurance. My Medicaid was cut off after 15 years of being on Medicaid. I no longer qualify, according to the administration. I require for my life medications. I take 23 pills a day. From about a dozen medications. My total bill, if I were to buy them myself, which I can't afford to do, but it's $1,168 a month for my medications. I am not going to be able to afford that. I just afforded what I could. I got 7 medications out of 12. I can't buy the other ones. Some of them are just way out of touch. There's nothing I can do about it. There's no one to reapply to. There's no one to complain to. There's really, I'm shit out of luck, basically. I'm not complaining. I'm just saying it happened, okay? So if you're thinking that it can't happen to you, I'm just a guy, all right? I'm just a guy who doesn't have insurance anymore. To get insurance, from what I understand, for me to get insurance will cost me just about what I would pay for my medications. I can't get a discount on my medications because I don't qualify, because I'm in an income bracket that doesn't qualify me to get a discount. I'm not sure how that works, but I'm retired. I have a retirement check, and that's it. And I don't have millions of dollars in stocks and bonds, and I don't have investment properties and this and that. I have my retirement, and I have what little savings I have, and that's it. I have a car. I rent an apartment. So I'm going to think I'm probably like a lot of other people out there. I'm normal, I guess. I'm just like you, I guess. If you have it better, congratulations. I'm happy for you. Trust me, I am. If you have it worse, I'm sorry that you do. If you're the same as me, we're in this shit together. Right now, I'm not trying to be gloom and doom, but I don't see any way out of this. I don't see any light at the end of the tunnel. So if there is, great. I want to know about it. But from my angle, I can either take my medications and not eat, or I can take what I can afford of my medications and hopefully not die. those are kind of my choices right now, because there are no companies coming to my rescue to say, oh, we can cut your drug prices by 1,500%. We don't have those on this planet, okay? This is the real world we're talking about. This is not some made-up reality by someone who has never had to buy a thing in his life, okay? From someone who has never had to work a day in his life. I've been working since I was 11, and I retired last year at the age of 62 because I couldn't physically do it anymore. So I earned my retirement. That's all I have left. If that gets taken away, then it's time for, one in the temple, and that's the end. So what else can you do? I can't go work again. I guess maybe I could. Maybe I could sell lemonade. Who knows? I'm saying this only because this is how it all goes. 2 days ago, I wouldn't have thought that I was going to lose Medicaid. My insurance, I can't go to the doctors now. I can't go to the dentist. I couldn't go to the dentist anyways. They never pay for shit. But you can't get glasses. You can't get medications. Without medications, a lot of us won't make it. I take medications for psychiatric issues, but I also take an enormous amount of medications to keep me alive, whether it's thyroid, I've had traumatic pancreatitis, I've had other issues in my body, which if they're not maintained, will kill me, basically. I'm not saying that that's going to happen tomorrow, but the reason doctors give you medications is to stop things that are wrong or to maintain things. And I have been maintaining for 15 years, taking my medications exactly when they're supposed to be taken in the morning and at night, and being very, very, very good at making sure that I do what I'm supposed to do, because I want to live. I think this is a pretty cool way to go about life. So I don't think that I am going to freak out. I'm just going to have to learn how to live without certain things. I did a post recently on the cost of groceries. If you're getting them cheap, fan-fucking-tastic. I'm so happy for you. Whatever planet you're living on, please give them my regards. In my world and on my planet, my fucking groceries are through the roof. Okay? They're costing me more than double what they did 6 months ago. More than double. Not just a little here and a little there. They're fucking more than double. I know this because I actually pay for them out of my own pocket with green foldable money. I don't have credit cards. I don't put it on somebody else's card. I don't have EBT. I don't have SNAP. I don't have any of that shit which would help me pay for my groceries. I buy them with cash. That's it. So now, you want to know how I know that mine are doubled? It's because in December, they cost me $50 a week. And I just went grocery shopping the other day and they were $116. I haven't changed my eating habits. They're exactly the same as they always have been. I'm a creature of habit. Bought the same shit that I bought in December. I bought it $116. Did they get a new grocery store? Did they just charge me more because I'm a Democrat? Or what is it? So for all of you who think that this is all some game and it's wonderful and cheerful and life is great, and this disease is doing us any favors by making our lives so chaotic and making us so crazy that we're going to just come out of this smelling like a rose. It's not going to work. The only person that will come out of this with anything will be the disease. Hopefully he'll come out of it in a coffin. But if he doesn't die, I want him just to take his money and go away. Just go away. We should have a GoFundMe and give all of our money to him to go away. If he would sign an agreement, I bet we could raise some billions of dollars to make him go away. That would be wonderful. He has enriched himself so much that we can't even fathom it. I'm not jealous because I'm not a criminal. I'm not a loser like that. But it makes me wonder, what is it about this one person that makes it perfectly acceptable for him to be a felon, a rapist, a pedophile, a fraud, a cheater, a liar? All of these things he is, and we know he is. Why do we allow it to happen? Why do we continue to let this disease affect us? Why is it keep going on? And how in hell does the Supreme Court of the United States bend its will to let him do whatever he wants to do? And everybody bends just to let him do it all. I saw him on the roof of the White House, and I was thinking, oh, thank God, he's gonna jump. He's gonna jump right off into the fucking new paved over rose garden. But he didn't. You know, it's only 2 or 3 stories anyway, so he probably would have just broke a hip or something, and then we'd end up having to fucking pay for him, you know, for the rest of his life, which we are going to be anyways. We will be paying his debts for the next 5 generations. Sorry to say, the trillions of dollars that he's put us fucked up in debt will be for the next 5 generations. They will be paying for it. That is his only thing that he's done for anybody, is he's fucked the next 5 generations. So find some peace, everybody. I love you all, and I'll see you again later.
My brother was hit by a drunk driver in 1996, 10 o'clock in the morning. Because of that, he is in a nursing home, and Medicaid pays for that. Because my 70-year-old mother, who has had 6 back operations and lives off of disability, cannot afford private insurance. But what I've come to realize is that the people that support this big, beautiful bill that's going to literally gut Medicaid, that so many people live off of for insurance to survive, literally stay alive, they don't care. They truly do not care about the people it's going to affect, because they have this idea, this very corrupt idea, that people that are on Medicaid are just a bunch of lazy American citizens who lay on their couch all day and won't work, when in reality it's people that can't work. And I don't understand how we got here to where people actually get joy out of inflicting this kind of pain upon people, upon families. And they're cutting these social programs with this bill so that they can pour billions of dollars to deport law-abiding Americans to these ICE concentration camps. And there are people hooting and hollering in celebration of that. I ask myself every day, what is wrong with people? I got a degree trying to figure out what the hell is wrong with people. And I have yet to draw a conclusion, because every day I am surprised by the level of disdain they have for other people. It is truly so heartbreaking.
Are you ready for your local hometown hospital, your nursing homes where your loved ones live at, to close down? Are you ready to lose your job that you've had for decades? Well, guess what? Because this big, beautiful bill has been passed, not only are millions of Americans losing health insurance, but hospitals, nursing homes, and other medical entities rely on Medicaid payments to stay alive. This is the largest healthcare cut in U.S. history. So geez, I'm really sorry. I hope you can find a place for your grandma, your grandpa, your mom, your dad, your sister, your brother to live. Honestly, I just hope that if you did end up losing your critical access hospital in the middle of nowhere to these cuts, that somehow you can survive the extra 30, 45, 60 miles away to the next hospital. You can thank your politicians, the Republicans, Congress, and President Trump for that. And if you're about to be upset that, gosh, Emily, I hate that you're being political, healthcare has always been political. I grew up in a Republican town with a critical access hospital, and I'm proud of my roots. But honestly, these politicians don't care about your healthcare, and they don't care if you die. All they care about is saving money, even if it's at the expense of your life and your loved ones.
Did you guys see that woman talking about her father getting kicked out of the nursing home? Well, apparently the nursing homes are kicking out their Medicare patients. And she was like, why would they do that? And everyone in the comments was like, honey, this is what you voted for. This is Medicare cuts. This is the big, beautiful bill. And she was like, no, that's not it. Yes, it is. I work in skilled nursing. 90% of the residents that are in there, they are Medicare patients. These buildings stay open because of Medicare. They will close down. They will not care for your aging parents and grandparents for free. They will send them home to you. You will have to quit your job and stay home and take care of them. That means you're going to have to be the caregiver for your father, your husband, your kids. You're going to have to quit your job. You're going to do all this on half the income for your household. This economy is going to suffer greatly when these places start closing down. This is one of the reasons, this is the main reason why I did not want to rely on the U.S. for my income while I'm living abroad. The economy here is bound to crash. When you cut Medicare like that and these places close, a lot of people are going to lose their jobs. The dollar is going to suffer. There is no forethought with these people. They have no idea what is happening.
You bring your elderly parent to the doctor and you say, I cannot take care of my dad. He needs lifting, he needs help in the bathroom, he needs help feeding, everything. I have my own kids, I have my own job, I have my own family. There is no social support. Only if you are wealthy can you buy that privately. Your primary care doctor cannot suggest that your dad should get admitted to a nursing home and that Medicare can cover. When I work on the inpatient side of things, cannot go see your dad down in the ED and suggest, oh, what he needs is help with daily activities of living. He should go to a nursing home. No, I have to admit him to the hospital, even though I as a doctor do not believe in that, so that the case manager can now send out a prior authorization as long as he has stayed in the hospital for at least 2 nights. And you're not paying the observation rate, you're paying the inpatient rate because they only accept from inpatient. This is what drains our money in this country. And you know where that money is being drained first? The American people. We are putting Americans in so much debt through the system, and the hospital is making a profit. And it does not go to physician salaries. You can bet on that. I have admitted patients before. Medicare doesn't even want to cover anyway. Now we're looking at other options like Medicaid. In order to qualify for Medicaid, you have to make no money at all. And by money, I'm not talking about the cash flowing in. I'm talking about everything you own. Your car, your house, your savings that you've worked your butt off your entire life. Things you want to pass down to your kids after you die. Yeah, guess what you have to do with those things? You have to do what's called spend down. You have to sell that car. You have to sell that house. You have to be poor enough to qualify for Medicaid in this country so that you can go die with grace in a nursing home. We are so jaded, and this happens all the time, and we know it's wrong. We just live with the system. Cuts to Medicaid? Cut what? We are charging people who make $30,000 a year and supporting their family. We are charging them tens of thousands of dollars. People in the United States work until they die. This is a non-partisan issue. We are all human beings. As a citizen, you should be taken care of by your government at the end of life, especially if you've paid taxes your entire life and you're
So you were telling me that people are unaware, they're unaware that the whole reason why hospitals are not allowed to turn you away in an emergency situation, regardless of your ability to pay, is because of the Emergency Medical Treatment and Labor Act, which states that hospitals who receive Medicare funding are not allowed to turn you away. And they are proposing to cut back on Medicare and Medicaid. Talk to a caseworker. There are no ineligible people who are receiving it. The only people who are receiving it are eligible because there is a vetting process. All these people that they say are illegally getting it, it's not happening. The point is to start the process to get rid of it entirely. And if we get rid of the only guaranteed payment for medical care in this country and we leave it all to our pockets with no support, guess what's going to happen to you? You are going to lose out on care because hospitals are going to close who depend on that funding. We don't have enough money to pay the bills that they decided were fair. Which, I'm sorry, I just had a life-saving surgery and I owe $3,000. If I don't pay $55 fucking dollars that I don't have to my primary care physician, they can decide to no longer treat me, and they will. And I've got to start all over again somewhere else. You all think that you're safe because, it's been that way because we fought to get it that way, and they're reversing it. You all have been so fucking pampered that you don't understand what we had to fight for to get you. Oh, but everyone dies. Bitch, apparently not fucking politicians.
Yeah. This is so sad. Like, I just had a member break down crying on the phone because they took her Medicaid because she makes $40 over the limit. And she has to see a specialist. And the specialist now costs her $50 every time she sees the specialist, which her Medicaid covered because she needs to see the specialist often. And a lot of people might say, well, it's just $50. She gonna get a bill later on. But to a lot of people, they don't want to have those bills. They don't want that to be sent to collections. Or y'all might feel like, well, they're elderly. Go ahead and just get the bill and blah, blah. People they're not thinking like that. And that lady just broke down because she was calling to see if she had to pay the money. And I'm like, well, unfortunately, because of the changes of you losing your Medicaid, you do have to pay these bills. And she broke down. And she's like, I'm alone. I don't work. They're saying I make more money than I do. Well, look, now y'all gonna try to... She work, but barely. The lady ain't making no money. Like, it's so sad, y'all.
Today's news for the unemployed. Nursing homes will be removing Medicaid residents within the next 20 to 30 days. Meaning, if anybody's in a nursing home and they are receiving Medicaid benefits to stay in that nursing home, they are going to have to leave. Their family is going to have to come and pick them up and remove them from the nursing home if they are receiving Medicaid. Child, I don't know how this is going to work because we all know the majority of those that are on Medicaid in nursing homes are this, and the majority that are taking care of them are this. So if the families already put them in nursing homes because they can't take care of them, how are y'all going to go about it now that you have to remove them?
Big, beautiful bill. So for all y'all said that the changes to the Medicaid program were only for the able-bodied people, we just got to get these people to work. You said it was not going to impact the disabled or the elderly. Yeah, I invite you to scroll your TikTok timeline today and see all the families that got notices that said that they have to get their parents and their elderly people and disabled people out the nursing home because the nursing home is no longer going to be accepting Medicaid. Now you tell me what's going to happen to these people. There's already a shortage of beds when it comes to this population anyway. So where are they going to go? Home with the family? Families aren't trained in this type of care. They can't afford to have nurses to come in. If they could, they wouldn't have their people in a nursing home, right? A process of elimination, no pun intended. Tell me what's going to happen to these people. Because your administration doesn't want Medicaid. And what's sad is that this is just a precursor to the impact of the big bad bill. Yeah. Y'all voted for that.
My medication, it runs $20,000 a month without insurance. I make $800 a month. Oh, that will kill me. That would kill my friends. That would kill millions of people in this country if they lose their health care.
We're in California's District 22, a rural community in the state's Central Valley. This district voted for Trump for the first time in 2024, but now his policies threaten one of the benefits people here rely on the most. Do you know anyone personally who voted for President Trump but depends on benefits like Medicaid?
Oh yeah, I know a lot of people.
One resident who would be impacted by Medicaid cuts is 64-year-old Irma Arredondo, who voted for Trump in 2024. Irma has several chronic health issues, including type 1 diabetes. She's also a full-time caregiver for her daughter, who has cerebral palsy, and her sister, who has Turner syndrome.
The medicine that my daughter takes for seizures, I won't be able to afford it. So we feel hopeless if those cuts come, you know. What we're going to do.
Irma was a farm worker for more than a decade. She believes that some of her and her children's health issues can be linked to the pesticides she was exposed to while working in the fields.
Look at me right now. Look at me, how many sicknesses that I have. We got all in the fields. Where else? I feel like this tubbiness in the back, you know. But why? Why when we put food on their tables? Trump promised a lot of things. I thought it would be more family values and those programs that we really need here.
One of those promises was to protect Medicaid, which 67% of people in this district rely on. It's the largest percentage of any district in the entire country.
Can you guarantee that Medicare, Medicaid will not be touched?
Yeah, I mean, I have said it so many times, we're not going to touch it.
The yeas are 218, the nays are 214. The motion is adopted.
This bill represents the largest cut to Medicaid in American history. It will devastate vulnerable populations.
The largest tax break go to the wealthiest individuals. Are those your values?
No, that's not right.
Irma isn't the only one in District 22 who feels betrayed by the administration's plan to gut Medicaid.
The only people they're hurting are the poor people. People that really need the stuff. Elon Musk doesn't need it. Trump doesn't need it. And, you know, billionaires don't need it.
They're making out big time with this, but they're hurting people in the process.
If we could go back to November, who would you vote for now, seeing what you see?
For either one.
You just wouldn't have voted.
Medicare is at risk for so many different Americans right now, you guys. The 2025 federal budget reconciliation bill passed by Congress on July 4th. It was signed into law on July 4th, 2025, and it is projected to trigger significant Medicare cuts due to Statutory Pay-As-You-Go Act of 2010. Now, they say that this mandates automatic spending reductions if legislation increases the federal deficit. Now, according to the Congressional Budget Office, CBO, these cuts are estimated to total approximately $5 billion to Medicare over the period from 2026 to 2034. Specifically, the CBO projects the cuts will start at $45 billion in 2026, increasing to $75 billion by 2034. These reductions are not explicitly detailed in the bill, but are triggered by the bill's estimated $2.3 trillion deficit increase over the next 10 years. This will affect Medicare, this will affect SNAP benefits, this will affect Meal on Wheels, this will affect so many different people, okay, y'all? Some sources, including posters on X, are citing slightly varying figures such as $535 billion or even $506 billion in Medicare cuts over the same period, okay, y'all? But these are not consistently corroborated by primary sources like CBO. Without further congressional action to waive or offset the deficit, these automatic cuts are expected to impact Medicare beneficiaries by potentially reducing access to care, increasing out-of-pocket costs, and affecting provider reimbursements, particularly for hospitals and physicians. It affects Medicaid by $930 billion, okay, y'all? Medicare will be over $50 million cut. FEMA cuts will be cut. SNAP cuts. Meals on Wheels, like I said it to you guys before. If you're receiving Medicare, please be aware. I have residents who had to go home because their Medicare has been cut. Okay, you guys? If you're relying on Medicare, they're cutting you for your income. Some people are only making an income of about $2,000, $3,000 a month, and their rent is honestly almost that. So they can't even get no food assistance because they're making over $1,200 a month. But you guys have rent that's over $1,200 a month as well. Then you have light bill and gas bill and other necessities. They're making it very fucking hard for people. Well, they want you guys to depend on them. That's the problem. Okay, y'all? They want us to depend on them, and they want to give us the options they want us to have. Free will, no more. Freedom of speech, no more. Privacy, no more. Understand this. The government is closing down as we know it. The world is over as we know it. When y'all say it's the end of the world, it's the end of the world as we know it. And the revolution will not be televised on fucking television. It's what you see. Go off what you're seeing. Go off this shit, y'all. We have to understand that this shit is literally, it's a shit show. Okay? For one, take your health into your own hands. Take your health into your own hands. We cannot depend on them for anything.
Take your life into your own hands. Protect yourself, protect your family, protect your environment, and protect your future, because this is insane. They're cutting Medicare for people who really need it. People can't even get heart transplants. These insurance companies are fucking scamming people. Literally scamming.
And so it begins. In certain states, nursing homes have already started reaching out to their residents who receive Medicaid, giving them 30 days to find another place basically to get their care provided to them. Why, you ask? Come on, sip a little tea with Auntie. Let's talk about it. The big beautiful bill. The big beautiful bill. These companies, these nursing homes are coming to the realization that they're losing money by having these residents in their facility. But secondly, y'all, I want y'all to think deeper into it. If these residents, I'd say probably 60% or 70% of the residents inside of nursing homes, a good bit of them, y'all, are there because of Medicaid. You know, if they getting rid of 60, 70% of Medicaid people, who takes care of most of those residents in the nursing home? Think about it. The nurses are there to give them their medicine, assist with wound care and all that other stuff. But the basis of their bathing and feeding them and changing their beds and all that stuff is typically the job of a CNA. If you ain't got no residents, what you need CNAs for? It all works hand in hand. CNAs gonna have to find other locations to work at. Residents gonna have to find locations that accept Medicaid, which is gonna be far and few for a whole lot of people, for the simple fact of they're gonna be losing more money than they're gaining by keeping people who receive Medicaid to pay for their health, their well-being, they're taken care of inside of these facilities. It's gonna get rough. And it's not just gonna start and end with nursing homes either. Think about those rural areas. The state of Louisiana is full of them that only have 2 hospitals in these rural areas. 1 out of 2 is going to close. What does that mean for you if you stay in an hour and a half before your only emergency facility for you to be able to get to? Can't run to an urgent care real quick because they getting ready to close them down too. A lot of people in one place. It's not going to be good, y'all. This is only the beginning. And I'm not on here trying to fearmonger nobody, y'all. These are facts. This is happening ahead of time. If you don't believe me, just go type in your search bar and look at this video of this young lady who's puzzled right now because she don't know where she's going to put her father at. He's in a nursing home. He receives Medicaid that pays for his stay in that nursing home, and they gave her 30 days. He has to be out of that nursing home by September the 15th. He has to be gone out of the nursing home and find another location that'll accept him with his Medicaid. It's sad, y'all. It is sad. Thank y'all for sipping a little more tea. What ain't tea?
Is Medicaid really getting cut for 17 million Americans? You've probably heard that all over social media, but let's clear things up, because the truth is a lot less dramatic than the headlines. So everybody's panicking about the one big beautiful bill about to take away Medicaid for millions of Americans. But if you actually take a look at the bill, that's not what's happening. Medicaid isn't being cut for 17 million people. So what's really going on? The bill says, and I'm quoting here, "No able-bodied adult without dependents shall be eligible for medical assistance under this title unless such individual is employed, looking for employment, or participating in a qualifying work or in a community engagement activity for a minimum of 20 hours a week." Translation: if you're a healthy adult and you don't have any kids that you're caring for, you have to show that you're working, looking for work, or engaging in community service for at least 20 hours a week. But there are a lot of other exceptions that the bill spells out. If you're over 65, you're exempt. If you're disabled or unable to work, you're exempt. If you're pregnant, you're exempt. If you're taking care of a child under 18, you're exempt. If you're already in school full-time, you're exempt. If you're the primary caregiver for someone disabled, you're exempt too. So honestly, this isn't about punishing the vulnerable and ripping healthcare away from families. I get why people are scared. Nobody wants to see healthcare getting ripped away from people that actually need it. But the reality is, if you're in one of these situations, you can keep your Medicaid. It's only targeting able-bodied adults that aren't working or even looking for work. There are too many people in this country that have taken advantage and abused this system for far too long. And the reality is, Medicaid only has so much money to go around. So when people abuse this system, it only takes away money from people that actually need it. So the real debate is, will this work requirement actually get people off their lazy butts and contribute to society instead of abusing a system that's meant for people that actually need it? Drop your thoughts in the comments, hit like if you learned something, share this video for people that are confused or being misled by all the misinformation, and follow for more breakdowns that cut through the noise. Don't fall for the hype, always check what the bill actually says.
Okay, so this morning I get up and I'm seeing all of these people down my timeline talking about the fact that in the next 20 to 30 days, they have to come get their parents out of the nursing home because the nursing homes no longer accept the Medicaid and Medicare or whatever, right? it brought me back to in my early 20s when I was working at a nursing home. I was activity director. And I remember that majority of the people that lived at the nursing home were older white people. Majority from up north, but you get what I'm saying. Older white people. The thing that gets me is the fact that people voted for this to go away, right? You voted for it. I don't know if you voted for it thinking that there were going to be some exceptions, but you voted for this. And to see so many, and I'm sorry, but that's what I'm seeing, so many white people on here complain about the fact that they have jobs, they have families, they can't take care of their parents. Because I remember working in those nursing homes, a lot of those people were on, heavy medications that they had to take every so many hours. They were on breathing machines. They had to have 24 hours, 7 days a week, around the clock care. They had to be, bathed, fed, and turned. Get ready to quit your jobs, buttercups, because when I was working at those nursing homes, the one particular race that I didn't see in there wiping butts and feeding people were white people. I'm sorry, it's the truth. Majority of those people that worked in those nursing homes taking care of your mothers and fathers were black and brown people. The only white people that really worked in nursing homes were always the directors or something like that. They were the ones at the top of the food chain, right? So now that you got to come and get your parents out of these nursing homes, I'm petrified of what's going to happen to these people, because you got to turn them every so many hours. You got to feed them every so many hours. They're on ventilators. They got to take medications at a certain time. I'm almost petrified of what's going to happen to these people. But you voted for this. And now you got to be the CNAs, the home CNAs for your parents. And I don't know about the rest of y'all, but have you ever picked up your mom or your dad that what now weighs, 235 pounds of dead weight? Baby, that ain't nothing to play with. And if you can't afford for them to be in these nursing homes, you damn sure are not going to be able to afford somebody to come in your home and take care of your parents. And you guys don't be united like that. You hardly ever see black people in nursing homes. Rarely you do. Sometimes you do. But majority of a nursing home is filled with older white people. I'm scared of what's going to happen to these older people in here. Them being at home, no one's, coming to see if they're okay or if they're getting their medications. Now it's just you and them. And you're not going to be able to afford the medications that your mom and your dad is on. This is going to be a big ass problem. But y'all ain't think about that when y'all asses out there voting, did you? Because you thought it was going to be everybody else, and now it's your...
Yep. Them nursing homes finna not take Medicaid, so y'all better get them rooms ready for Meemaw and Pawpaw. Yeah, combine them kids' room. Get rid of the den, man cave, whatever y'all got, scoot it over, because Meemaw and Pawpaw is coming to the crib. I don't want to hear nothing. This is not what I voted for. Yes, this is absolutely what you voted for. Okay? No, I don't want to hear any of that. Meemaw and Pawpaw will be at the crib in 30 to 45 days. All right? Yeah. Yeah. That's where we are. And listen, before you get in my comments with that red, blue, left, right, I don't want to hear none of that, bro. You can put that Trump hat and that shirt on your Meemaw and Pawpaw, but they coming to the crib. You can best believe that. If your in-laws use Medicaid, a lot of these services are going to not accept Medicaid. So yeah, make room.
A lot of nursing homes are no longer accepting Medicaid, so that means a lot of folks got to go get their parents out of them nursing homes within a matter of 30 days. So I want to know if a lot of people prepared for this. Like, it's difficult taking care of the elderly. If you're not used to doing it, like, I know because I deliver at a lot of nursing homes, all right? So it be mostly my race in there, far as taking care of people. Like the CNAs, most of them, they my race, all right? And a lot of nurses in there be my race. You catch a few YT people in there, but not too many. But it's a lot of YT people in there that's getting taken care of, all right? So I want to know, are the YT people ready to get their parents up out of there and uncles and aunties up out of there and be taken care of. Because, you know, you gotta go check on them every so couple minutes and flip them over, and you know they gotta be flipped over every 30 or every hour and something like that. That's difficult because it's like they dead weight, and if you ain't never picked up dead weight, it's gonna be a problem for you, you know. And feeding them and giving them time, it's like the older you get, the more you turn back into a baby. It's like taking care of a baby again. When you a baby, you know how you gotta constantly look back over because it's a baby. That's how an elderly person is. Once they start getting sick and all this, like they taking care of a baby again. I want to know, is people ready for that? You know, and because they saying they ain't accepting the Medicaid and shit no more, and that shit expensive. So now you need people to come to your house and take care of your parents or your folks, your relatives, or whoever it may be. And that shit expensive. I want to know if people ready for that. Y'all let me know down in the comment section.
Now that the one big beautiful bill, that name is crazy, have been approved, which cuts Medicare, Medicaid, SNAP, and some other benefits, what exactly does that mean for you? That means that elders that used to be able to qualify for SNAP and these benefits after the age of 54 now would not qualify for it until they're 65. Also, parents who were able to not work and receive these benefits up until the child is 17 now have to go to work. You no longer qualify if you don't work. To qualify for these benefits, so they're not getting rid of them. To qualify for these benefits, you have to work at least 80 hours a month up to the age of 65. Of course, if you work, then your benefit amount will go down because that is how SNAP works, is based on your income. However, it doesn't have to be paid work. You either have to have a job that pays money, volunteer, or be in some kind of class that will give you some kind of trade. I'm telling you this because I don't want people to freak out. No, these circumstances are not good. Maybe you don't have anyone to watch your children. Maybe you don't trust anybody watching your children because of traumatic experiences you've had as a child. However, what you should not do is give out any energy of fear and panic, because that's really what they're banking on, allegedly. I've told you before that the highest currency is energy. Negative energy is very, very powerful and very, very delicious to some. Be careful who you feed. Keep in mind that there was a time that none of these benefits even existed, and yet humanity survived. So, this is a perfect time to start praying, meditating, looking inward, connecting with nature, grounding, doing things, find your creative outlet. Keep in mind, throughout anything, you are the creator of your reality. So knowing what you know, what do you plan on creating from here on?
Yep, them nursing homes finna not take Medicaid, so y'all better get them rooms ready for Meemaw and Pawpaw. Yeah, combine them kids' room, get rid of the den, man cave, whatever y'all got, scoot it over, because Meemaw and Pawpaw is coming to the crib. I don't want to hear nothing. This is not what I voted for. Yes, this is absolutely what you voted for. Okay? No, I don't want to hear any of that. Meemaw and Pawpaw will be at the crib in 30 to 45 days. All right? Yeah. Yeah. That's where we are. And listen, before you get in my comments with that red, blue, left, right, I don't want to hear none of that, bro. You can put that Trump hat and that shirt on your Meemaw and Pawpaw, but they coming to the crib. You can best believe that. If your in-laws use Medicaid, a lot of these services are going to not accept Medicaid. So yeah, make room.
So, trending on social media right now, there is a woman asking why her father is being kicked out of his nursing home by September and he's on Medicaid. So, let's talk about why this is happening. Across the country, nursing homes are cutting ties with Medicaid residents, not because they want to, but because they can't afford to keep them. Medicaid pays some of the lowest reimbursement rates in the entire healthcare system. And in many states, those rates haven't kept up with inflation, staffing costs, or increased medical complexity. So nursing homes are losing money on every Medicaid patient that they currently care for. This crisis didn't start overnight. Under the Trump administration, federal policy pushed for Medicaid cuts, block grants, and privatization, what he likes to call the Big Beautiful Bill. That agenda sought to limit federal Medicaid funding and shift the financial burden to states. So now in 2025, we are living with the consequences. The COVID era protections that paused redeterminations are long gone. Medicaid unwinding has dropped over 20 million people. And with fewer residents covered and payments still too low, nursing homes are making hard financial choices. So some are shutting down entire wings. Others are refusing new Medicaid admissions. And yes, some are discharging long-term residents. So if you're asking why your father is being kicked out, the answer is because the system is being defunded on purpose. When you vote for politicians who promise to shrink entitlements, this is the real world result. Elderly people getting eviction notices. This isn't just bureaucracy, it's policy, and it's hurting families.
So I'm a fucking CNA, and I just heard this, but if you have a loved one who is on Medicaid and is in a nursing home, like in the next 20 to 30 days, like every elderly person who has Medicaid in a nursing home has to be picked up by their family. Like it no longer applies. Like no, oh my God, 90% of people in the nursing home are on Medicaid. What do you mean? That's literally everybody. What the fuck is gonna happen to these people? Does anybody give a fuck? Are you fucking kidding me? This is actually happening.
We're starting to hear from people who are on Medicaid who are losing access to certain services, be it long-term care, nursing homes, outpatient services, things like that are getting cut. And the GOP has consistently said that people will not be kicked off Medicaid. And that may be true. A lot of people won't be. It doesn't seem as though any Republican voters feel like they will not qualify with the work requirement. But just because you're not losing your Medicaid doesn't mean that you're not going to lose your access to health care. $900 billion has been cut. And states have to make up that difference. There's a lot of different ways they can make up that difference. Kicking people off is one of those ways. Another way is to cut certain services that Medicaid pays for. I live in Alabama, a state that has refused to expand Medicaid, so we were already at a disadvantage, and now we're going to get cut even more. Trust me when I say that Alabama cannot make up that difference. I'm going to read to you the email that I sent one of my state senators, Katie Britt, not Tommy Tuberville. Katie Britt's been pretty reasonable on some of these issues, so I thought maybe she would listen. I thought I might get an actual response. That wasn't the case. I posted this on Facebook before the bill passed. I consider myself an independent voter, but I was raised in an extremely conservative community, and the Republican Party has been very good to my family. My brother was a congressional page for Spencer Backus. Congressman Backus wrote my brother's recommendation letter for the Merchant Marine Academy. I've been a CRNA in Alabama for 18 years. The Medicaid cuts that are being proposed are going to wreck our hospitals. Alabama cannot afford to bridge an even larger gap than we already have, not even close. Roughly 1 in 4 Alabamians rely on Medicaid, and nearly 1 in 10 have no health insurance at all. That's already one of the highest uninsured rates in the country. Without Medicaid support, like outpatient services, even more patients will be left with nowhere to go but the emergency room. EMTALA is a federal law that requires us to provide emergency services to all human beings, regardless of where they came from or their ability to pay for it. Our oath as providers and our state's aggressive commitment to Christian values require the same. We do not and cannot turn away life-threatening emergencies or laboring patients. The proposed cuts will force us to provide even more of that care for free. Our hospitals cannot absorb that level of uncompensated care without collapsing. Poor Medicaid reimbursement rates combined with cuts to essential outpatient services and a potential loss of coverage for thousands will devastate Alabama's rural healthcare infrastructure. Many rural hospitals are already on the brink. Additional pressure from unfunded mandates will push them over the edge, and once they close, they rarely reopen. Your constituents need you to push back on this. If rural hospitals close, it won't just affect Medicaid patients. It will affect all of us. Most of your voters do not live near a major hospital. This will affect a massive portion of your base. We don't have much time. I look forward to a reply. Thank you. Here's her reply. You can pause to read it. You may have to screenshot it and zoom in if you have eyes like me. But it basically has nothing to do with anything that I said. She talks about Trump's tax cuts. Why would you talk about that? That you're cutting health care to fund that. So no thank you. And then she talks about the border. Like, we're not a border state. What the hell? And then more nonsense. I think this is just a auto reply for any question or concern that comes into her email. I hope I'm wrong, Katie Britt. I honestly hope I'm wrong.
Aetna is making a massive cut to its Medicare Advantage portfolio for 2026, eliminating nearly 90 plans across 34 states. The company quietly notified third-party brokers this week, sending a wave of confusion through the insurance company and raising red flags for seniors that rely on this coverage. So this isn't a tweak. It's a large-scale retreat from markets where Aetna appears to be struggling with profitability or regulatory pressure. While full details on which counties and plans are being pulled haven't been released publicly yet, brokers report that entire service areas are going dark in states like Texas, Georgia, and Florida. This follows a broader trend of insurers, especially the major players, pulling back from aggressive Medicare Advantage growth strategies due to rising utilization costs, CMS crackdowns on overbilling, and heightened scrutiny on star ratings. For affected seniors, this means possible plan terminations, benefit disruptions, and forced switches during open enrollment. If you're a beneficiary, provider, or agent, now is the time to prepare. Aetna's exit will reshape local plan availability, network access, and member options, especially in rural or underserved areas.
Guess what, y'all? Medicaid just cut my check off. Ah! They said if I work part-time, they'll help me with my medical, and they send me a check every month to help me with my rent. Ah!
As promised, I got an update for you followers on my Medicaid case. We just got out of a meeting with our Humana caseworker. She came to the house. I asked some pretty hard questions and I got some pretty good answers. Some I didn't like. The bottom line is if you are on Medicaid now and your loved one meets all the requirements, you got nothing to worry about with the Medicaid cuts. In my case, I'm not concerned, neither is the caseworker concerned about my wife losing benefits. However, they are increasing the renewal rate from every 12 months to every 6 months. That is what scares me and the caseworker. And here's why. They're doubling the amount of workload for the folks that do these cases without increasing their manpower. Human error is going to play a factor. They're going to get behind and fuck this up. Her advice to me, my advice to you based on what we discussed, is if you are coming up for a renewal, do it online and do it early. I think you can go out to 45 days early. I've already made it. My renewal date is in April. I've already put it on the calendar at the house. It's like written on the hard calendar in old school Sharpie, and then I have it on my phone. That's the date that it's due, but I also backdated 45 days prior to that, start the application. I'm going to have to just accept that they're going to fuck it up. I'm going to start the application early. I'm going to start it online. I'm going to submit it. And somewhere on the other side, somebody's going to fuck it up because they're overworked and understaffed now. I don't know if this helps you or not, but what I learned was there's nothing for me to worry about because my wife really does deserve and has earned the requirements. But I am worried about them fucking up the renewal every 6 months. I hope this helps somebody. I love you guys.
So nursing homes are no longer taking Medicaid. So a lot of y'all gonna have to take care of your grandparents. This is crazy. Thanks to y'all new president.
Yo, who is this woman right here? Because she's doing what too many are afraid to do. Watch this.
In fact, you cut Medicaid so I couldn't get Obamacare. You're an asshole. You don't care about working people. I'm not talking to you. You don't care about working people. You should be ashamed to show your face around here. A million jobs? Great. Who here has a great job? Or is looking forward to finishing school? You really feel like you have a job coming up? You stripped women of access to public health care. Shame on you, Rick Scott. We depend on those services. Rich people like you don't know what to do. When poor people like us need health services, you cut them. Shame on you, Rick Scott. You're an embarrassment to our state.
She sees Florida Senator Rick Scott, a man who voted to strip women of their reproductive rights, slash Medicaid for low-income families, and block affordable health care, and she doesn't hold back. This is the same Rick Scott who chaired the GOP Senate campaign to overturn Roe v. Wade, who backed a plan to put all federal programs, including Social Security and Medicare, on the chopping block every 5 years. She's the only one in the room willing to speak truth to his face. Just facts. And when they tried to silence her, she kept going, because silence is exactly what politicians like him depend on. This is how you hold power accountable, not behind a screen and in public where they can't.
The patient has till the middle of September to find somewhere to go. Y'all, it is happening. I just seen last night when I was scrolling on TikTok. I'm going to tag the lady down below. Her father lives in a nursing home in Tennessee, and he has till the middle of September to find somewhere else to go because they are getting rid of all Medicaid beds. And as a healthcare worker who, yes, I work for like a home health agency, but I also go to facilities. This is a little scary to me. Like, I need to find me a backup plan and find it quick.
Have you heard all the stories on TikTok about nursing homes closing because of Medicaid cuts? Nursing homes are closing because of Medicaid cuts. I thought you were trying to get rid of waste, fraud, and abuse. Well, look at this. Tennessee, this is an FAFO for you, the red state of Tennessee, who voted for Donald Trump and is now going to have up to 12 nursing homes immediately closed due to cutting of Medicaid. There are 78 million Americans on Medicaid, 20% of the population.
So with this big, beautiful bill that we all voted for, including me, I have lost my insurance. My 6 kids have lost their insurance. Yeah, I just got a call from my son's therapist, okay? My son attends ABA therapy for his autism 5 days a week, 8 hours a day. His therapist just called me to let me know that his insurance has been canceled. So I call them, okay? I call Medicaid, Molina, whatever the hell they want to call it. Call them. Oh yeah, your insurance was lapsed. The kids' insurance has lapsed. All 6 kids haven't received a letter. No letter. This morning, I go to my mailbox. Guess what I have? A freaking letter. I just got that this morning. They are trying to tell me that my insurance was canceled the end of July. The end of July. It is now the 6th of August, and I am just getting informed. And the only reason I am getting informed is because his therapist let me know. My son needs his therapy. My son has medical needs, as well as my other 5 children. I go to a methadone clinic every single day, 4 days out of the week, and now I have no insurance. Now I have to pay out of pocket. They're trying to tell me that I am making too much. I am making too much for a family of 8. A family of 8, and I am making too much.
A woman on Twitter said that
A lot of people are about to lose their Medicaid and not realize it because their insurance is called something else in their state. Perfect example would be Texas, which is Star or Star Plus, CHIP, Georgia Pathways, New York State of Health, California, CalAIM or Medi-Cal, Maryland, Health Choice, Illinois, Health Choice Illinois. These are just some examples. And people really don't know that their insurance is Medicaid because they don't know what the real name is. I mean, even Florida has an acronym as SMMC. If you're not paying attention, you wouldn't even know that that's Medicaid. All I'm saying is that a lot of people are about to suffer, and it's not a fault of their own. It's just the government doesn't want to help you.
I'm sitting here and I'm thinking about it. I said, you know what? Medicaid cuts aren't going to last long because nursing homes are going to go out of business. And nursing homes aren't going to go out of business. Nursing homes are one of the most privatized healthcare platforms in America. Anywhere from $300 to $600 a day per bed. And Medicaid pays for 70% of all the nursing homes in the entire country.
My daughter's speech therapist went out of business because Medicaid reimbursement rates were too low. We do not have Medicaid. I'm going to keep posting this until people understand that when Medicaid gets cut, everyone loses services. What a lot of people don't seem to get is that Medicaid is not just for other people. It is baked into the entire system. When Medicaid takes a hit, everyone feels it. Services disappear, clinics close, wait times will explode. Therapists, doctors, even home health aides, they're going to burn out or they're going to leave the profession altogether. And not because they don't want to, but because they literally cannot afford to keep helping people. And this affects way more than just low-income families. Think about rural communities, elderly people in nursing homes, disabled adults, kids in school who need speech or occupational therapy. All of that gets gutted when Medicaid is underfunded. Schools lose specialists, hospitals shut down departments, emergency rooms get overwhelmed, and then guess what? Private insurance prices go up because they're covering the gaps that are left behind. Even if someone has private insurance, they might still rely on Medicaid covered providers without even realizing it. You might go to a clinic that takes all insurance, but if they lose their Medicaid patients, they can't keep the doors open. So now you just lost your provider too. And then people wonder why mental health services are impossible to get, why there's a 6-month wait to get a kid into speech therapy, why nursing homes are understaffed. Medicaid is the infrastructure. You pull one little thread and the whole thing starts to unravel. This parent is right to keep posting about it because cuts to Medicaid don't just affect them, they affect all of us, whether you want to admit it or not.
So it has been announced that Medicaid is getting cut off. If a family member live in a nursing home, y'all now have to find somewhere for them to stay because they will no longer be able to stay in the nursing home as long as they have Medicaid and they don't have another way to pay for the nursing home. And this is so sad. They said it was supposed to happen years down the line, but it's currently taking place now as I speak. And it's just like, how can y'all do something so cruel to the elderly? What about the ones that was in the nursing home and don't have no family? What about those ones? Like, it's just, America's just becoming more fucked up as the day passes by. I just don't understand anymore. Medicaid was brought up to support the ones that's in need, and now y'all taking it away. It's just like, where can they go? Families now have to take their parents back to their house and take care for them. They were put into the nursing home in the first place because they couldn't take care for them. And it's just like America will want to assist you just to take that assistance away. I don't indulge in any type of assistance.
Today I was at work at a doctor's office and we got a triage call from a woman whose husband was very sick and she was looking for some advice of what to do. And after talking with her for about a minute, it was obvious that she needed to bring her husband to the hospital. So I told her, you need to bring your husband to the hospital today. And she said, he's in a wheelchair and I can't get him out of the wheelchair into the car. I have no way of getting him there. So I said, call 911. This is what 911 is for. They will send EMTs to your house in an ambulance and they will transport him to the hospital safely. And she said, well, first of all, even if we do that, I have no way of getting him home. because the ambulance won't take him back home again. And he has Medicare, and Medicare doesn't always cover ambulance rides, and we can't afford the bill. So I called the hospital and asked them for some advice, and the social worker asked, do they have Medicaid along with Medicare? Because if they are low income and have Medicaid, then the ambulance ride to the hospital and the shuttle ride home will be free. And I said, no, they are not poor enough to qualify for Medicaid, but they don't have enough money to actually afford the ambulance ride to the hospital. I was closing out his chart at the end of the day, and I noticed on his list of doctor's visits, I could see that he had not checked into the hospital today. He was sitting at home all day, withering away, because they couldn't afford the ambulance ride to the hospital. Life is harder for your parents than you think. Sending them a text is not enough. They need your help.